Now let's get you caught up on the latest coronavirus numbers across Arizona.
We saw a big jump in new cases and deaths. We also have more COVID patients in our hospitals than ever before right now. Chris Pickle here in the studio tonight to break down the new numbers. Chris?
And guys, we're going to get right to the numbers because they are concerning. Look at this, more than 8,500 new cases reported, but this is the tough one that you see right there. 335 new deaths. I want to give you a little perspective on this. So we dug deeper into the data. Only half of these deaths happened this month. I want to go ahead and flip over here. The rest were last year and mostly in December. Last month was the deadliest month of the pandemic so far. More than 2,800 people died last month, but this is really scary because we are actually seeing more positive cases now. And there's always a correlation. When we see more cases, we see more deaths. So think of that. We are seeing more cases now. So if our trend holds, January could end up topping what we saw in December when we talk about the number of deaths. Now, we hope that doesn't happen, but it is something that we are currently monitoring. And our hospitals right now, they are overwhelmed. Look at this. ICU capacity, that is at 92%. This state, for this data, this is statewide. So some hospitals are at capacity, but others are not. So this is very interesting. I want to show you what our data team just added. This is something new to the dashboard. You look at this and you can now see how full ICUs are at individual hospitals. The deeper the color on these little boxes, that means the higher the capacity. So I just want to go ahead and click on one of them because it really breaks down the data. Let me see if I can pull up one of these. Okay, this would be the Abrazo Arrowhead campus, ICU capacity 100%. So 40 out of 40 ICU beds are in use. And of that, the data, if it stays up, it shows you ICU beds in use by COVID patients are at 77%. So let me go ahead and bring back that up. The information that we find on the dashboard, it is very important. It gives us an idea of how our state is doing in the pandemic, but we may actually lose some of that information when it comes to testing. Arizona's largest COVID testing site may have to shut down many of their locations if they don't get money from the federal government, and soon. Testing sites run by Embry Women's Health, they offer free COVID testing to thousands of Arizonans every day. Monica Garcia is now joining us live at their busiest location in Mesa Community College to explain what's happening out there. Monica?
Well, that's right, Chris. In the past 8 months, there's been a steady flow of traffic out here, especially during this time of the evening. Whether you have insurance or not, COVID testing is free here because Embry Women's Health is reimbursed by insurance companies. But there's been a hiccup happening and they're not getting reimbursed what they're used to. Try 80% less. Back in May, Raymond Embry with Embry Women's Health launched one of the first 24/7 testing sites in the state, going from 12 employees to 1,100 today.
We basically spent every dollar that's come in ensuring that we're able to support our staff,
while expanding to 50 drive-through locations across Arizona, many in rural communities where testing was lacking.
without any type of financial support.
Raymond says, and doing so without any CARES Act funding. Out of the state's 3.4 million COVID-19 tests taken so far, Embry is responsible for nearly 25% of those tests. But the free ride may be over.
Anybody who's ever worked with an insurance company before, they can take anywhere from 15 to 60 days to pay for a claim if you're lucky.
Not just that, Raymond says without warning, some of the biggest insurance providers are starting to cover less of the testing costs.
And the rate that they are willing to pay absolutely is not sustainable for a statewide COVID-19 testing operation.
Where he was once reimbursed $100 per test administered, he now gets just $11 per patient.
We have worked very hard, as you just kind of described, to increase access to testing statewide.
When asked why the sites weren't being federally funded, despite the state's reliance on their services, Dr. Kara Chris says they plan on working it out.
So we're working to provide them with staffing resources and potential funding to identify how we can help them.
In the meantime, Raymond doesn't know how long he can cover the cost to stay open out here. He's hoping if everything goes as planned, he can eventually start offering those COVID vaccinations in addition to testing. Live in Mesa, I'm Monica Garcia with Arizona's Family.
Okay, we'll follow up on that. Monica, thanks.